Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Now this podcast is going to be part 2 to the Integrating Rehab and Performance part 1, the exam. This is part 2, the treatment. So refer to the podcast or the companion article on the blog on the website integratedrpc.com to get the details on the exam and some of the background on the athlete that we were working with. And just to summarize here briefly, the part 1 talked about some of the key concepts of the exam, and we focused on our lower extremity portions of the exam. But again, at Integrated Rehab and Performance, we look at kind of a top-tier global movement screen. We want to see how all the joints are kind of working together, and it gives us a bit of an idea where to take a closer look, where things are kind of falling short in terms of mobility and stability. On top of that, we take a closer look looking at every single joint to see what the range of motion is looking like throughout the body, again, no matter where the complaint is, to get a sense where there is compression at certain spots in the body, where there is expansion being allowed, and then again, where there is just areas of more of a bony obstruction to mobility and things like that. So we get a good sense of what is going on in that regard as well, and where your kind of asymmetries and biases lie. From there, we just do our special testing where whatever the patient's coming in with, we need to take a closer look, have some things to compare to down the line. We always record most of our exam procedures so we know we have an objective measurement that we can look back to even if the patient's feeling better. And I see that they're moving better. We make sure to record it so we can compare it to when they came in before, and we can all see the differences, which really helps. Now, with this patient, we were working on the main issue was his snatch, which is an Olympic lifting move. He's a CrossFitter. So it is involved in the CrossFit workouts where he needs to be able to take a barbell from the ground to snatch it up overhead, catch it in a deep squat and an overhead squat, and then stand it up. And he's having some issues with his right heel kind of rotating outward and his heel coming off the ground when he would do that. He had some issues shifting into that side and trusting and putting weight into that hip. And what we had found from the exam, again focusing on the lower extremity portion of it, was that right hip lacked a lot of internal rotation. He did not know really how to shift into that hip, and then that ankle and foot needed a lot of mobility work as well, among some other things. So we cleared up that hip and then got him shifting. So anyways, that's what we're going to talk about today. Again, it's going to be brief. We'll talk about a few tidbits here and there about what we did to address those findings from that part 1. So again, go check out that part 1 exam. That was a brief overview of the exam. Now let's talk about some exercises that we use in situations like this. Again, this was a performance patient or client. If there was pain involved, we just spend some time also addressing pain, especially in the early phases of treatment. But that being said, let's take a closer look at what we did in our orientation or kind of phase 1 treatment. So again, we have usually 3 phases of treatment where we are addressing. One is orientation, and what I mean by orientation is what are the kind of broad biases of that person in front of me, and typically we look at the pelvis and the rib cage. So is this person biased towards an anterior tilt, right? So the pelvis is kind of tilted forward. If you think of it as like a bucket of water, that water is tilting out the front. The belt line is pointing down towards the ground. We find that to be often the case. And is the rib cage flaring up towards the sky instead of stacking over that pelvis? And again, that tends to be the case, but we can also get instances where that pelvis is tilted backwards, and there's something called the sway back posture, where again, when we have these sort of biases, we can also have the trunk where it's just more often than not rotated towards one side or the other, and we have to identify which side that is, and that'll show up in the mobility testing and joint range of motion testing, where there's compression and expansion that is created from those different biases and joint and global big body positioning. As well as at that hip, we can tell which side are you shifted into and rotated towards. Just generally speaking, you tend to live in that position. Which side is that? And that will show up and identify itself based, again, off those measurements. So phase 1 is just addressing what we know from our measurements in terms of is he anteriorly oriented or posteriorly oriented, like a sway back. And then same thing with the rib cage, where are we rotated and are we flared? And in this case, we had an anteriorly oriented and a rib flare position, and he was rotated towards the left, which tends to be less common, but again, that's what the measurements were showing. So we had to first pull him out of that anterior tilt and then put him a little bit more back into neutral in terms of that rotation, and then pull those ribs down. So let's talk a little bit about some of these exercises that we use to do that. Again, we use a chiropractic spinal exam. We look at the pelvis all the way up to the neck. We'll adjust any segments or sections of that spine that are feeling a little bit stiff and limiting our ability to get change and motion. We do soft tissue work. We identify which tissues could use a little bit of hands-on work to give us that extra bit of treatment to really give us the best chances of creating expansion and tissue expansion in different areas that we need it. And then we let the correctives after that and the exercises and mobilizing drills do the rest and more of the long-term work. So after doing some soft tissue work and again, we worked on that low back a little bit. We worked on some of the external rotators of certain parts of the hip, and then we did some hip flexor work and then some upper body stuff as well. And then we adjusted certain parts of the spine, and then it was time for correctives. One thing that we did was the hip lift in 90-90. So I'll show you what that looks like. Another drill that we did was a kind of hip lift with rotations or hip shifting, right? And so the hip lift, it was designed to pull that pelvis back, to learn how to use the hamstrings to pull the pelvis back and allow them to start doing that part of their job again, which a lot of people, they don't have that connection with their hamstrings anymore, but also learn from that neutral position to start shifting their hips again. So we'll show you what those look like here. These are two common phase one drills that we use. Okay, so here is the 90-90 hip lift with the rotations. This is kind of our 90-90 hip lift position, but we had him doing, this is an example of a later exercise, let me show you here, where we emphasized one side more than the other. Again, this was based off that rotation or asymmetry that we saw in that exam where he was kind of rotated in that pelvis to one side. So imagine that both feet are flat on the wall here like we saw here, or we can just take a look at this version of it where it's a little bit more specific to the patient in front of us, where we want to get that anteriorly that anterior orientation taken care of more so on that right side than the left, right? It's more anteriorly rotated on that right side, and we can emphasize that more so by having that right foot keep its contact. So what's happening here, and I have it running live, he's just breathing in this position, so just holding it static, and I'll pause it. This right foot is flat on the wall. This left one is put up into extension, but those hips are tilted backwards a little bit, so that pelvis is tilted a little bit backwards. You can think of it, his tailbone is kind of been pulled off the ground, but his belt line should still be in contact with the ground, so it's just a slight raise of that lower kind of tailbone and sacrum, pulling that pelvis into a posterior tilt, and then he's owning that position with some breathing. And he's again, we're emphasizing that right side. So his right pelvis, especially because that's where that's the side the hamstring is working on, is pulling that right pelvis in backwards into more of a neutral or posterior tilt. And then we're just breathing in this position. The breathing cues for this are very important. You can think of it as exhaling through the mouth like you're fogging a mirror in front of you. So just letting the air fall out of your mouth, and you want to get every single last bit of air out of the mouth. What you should feel when you start pushing that last 5% of air out of your lungs is you should feel your side abs or obliques start to kick on. Again, if you're in this position, it helps you to really feel that. Is in the very last bit of air that you're pushing out, you should feel your obliques or side abs start to turn on just a little bit, and that's those muscles working as they were designed to do, to compress that rib cage, pull that rib cage down and in to take up space, to take space away from the lungs, to really push and compress the lungs to push air out. We need those obliques to start working to control the rib cage again. We don't want the rectus abdominis working, so that six-pack, we don't want that doing all the work to push the air out. When you're doing this drill, we want to emphasize on keeping kind of like a jelly belly. As we're exhaling, we want just, again, other muscles to do the work of pushing that air out, and then at the very end, the obliques to do it. We don't want to use our six-pack abs to pull that pelvis up or to be taking over control too much, and we want to start using other muscles to do that. So that's a lot of different uses we get out of this drill. We are addressing the rib cage. We are learning how to use breath in a different way. And then again, we are working on that pelvis, especially on that right side with that anterior orientation. Again, he's just hanging out there. Now, we progress this, well, not so much progress, but a different version of this, just to get a feeling for how well his hips are moving in this position is, again, we have both feet on the floor. We're dragging our heels down, but the friction of the wall is keeping them there. And from there, that's going to raise our pelvis off the ground just slightly. Our tailbone's just scraping off the ground. Our belt line should still be on the ground. And then we are maintaining that position. You can see he's feeling his ribs to be able to feel as he exhales, those ribs come down. And at the same time, we're actually getting a shifting position. So we can hold that. That's our 90-90 hip lift, where we're just holding and breathing. We can do a version where we have one leg extended, like we saw when he was wearing the blue shirt. And then in this version, we're doing some rotating. So we're keeping that posterior tilt, that tailbone peeled off the ground as we rotate. And we see how can we rotate and use our hips in this neutral pelvic position. And it should just be subtle. We want to limit how much side-to-side sway we're getting through that. And then always maintaining full foot contacts in all these drills. Not losing the inside edge, the outside edge. The heel shouldn't be up on our toes. Toes shouldn't be pulling off the wall, nothing like that. Full foot contact. These are two great drills to start addressing an anterior orientation of that pelvis, and even get the breath involved to help work that rib cage and keep it stacked over our pelvis. Okay, and our second phase. So again, phase one, those are some of the basics. There's some things we can do for the upper extremity, upper body, as well as the lower body. There's some more things that we did. We used a specific drill with the rectus femoris. It's called the rec fem in extension. So what we do is we use the hamstring in a different way to pull that pelvis back into a neutral position, and then we flex the opposite side thigh and do some kind of knee extensions from there. Right? We did a lot of things to help pull that pelvis back and then start to challenge it a little bit and challenge him in that position to be able to own it. And we saw the range of motion start to shoot up after we started doing this for a week or two, where we got both hips back to that 30-degree goal of ours. Again, they started at 20 degrees and 10 degrees on the right side, and then we got both hips up to 30 degrees of internal rotation within just a week or two. Which just opens us up to so much more possibilities now. We've been fighting that hip all along the way. If we just started addressing that ankle and only looked at that ankle on the right side, it would have never really revealed itself. He never would have been able to shift back to the right side. He would have never been able to own that right hip. So many things in terms of his performance we would never have gotten there if we didn't first get that kind of prerequisite range of motion into that hip. But we also have to start addressing the ankle. So now in phase two, we're really addressing mobility and asymmetries directly, which in this case was we needed a little bit more of right hip internal rotation. So after the orientation drills, we were almost all the way to that 30 degrees. We just had to kind of, some asymmetries really revealed themselves. We had to work on our left glute max, our left hip external rotation, and then our right hip internal rotation, including the adductor or that groin muscle on the right side. So here, addressing mobility and asymmetries directly. Lower extremity, we're looking at that right ankle dorsiflexion and tibial internal rotation we had seen. And we're also working on right hip internal rotation and left hip external rotation. And the muscles we want to get involved is that left glute max to push us, externally rotate that hip in a closed chain. It'll push you into that right side. And then if you internally rotate in a closed chain, you're going to pull yourself to that side. So again, we're using the adductor to pull ourselves to the right side, and the left glute max to push us away from that left side and into the right side. And then we have to find a way to get those things to work together. So a couple things that we were able to do there is, first we did an adductor pullback. We also did a left glute max drill on the wall, and then we integrated those things together with an abduct and shift drill, which is kind of where we use both of those at the same time to really start to integrate that brain-body connection, that motor control of shifting into that side. And that's kind of the basis of that phase two stuff that we do. Again, we did some more things, but to really highlight and simplify what we were doing in phase two, it's probably these three exercises and drills. Okay, so first up here, we have the left glute max. We have him laying on his right side. Both his feet are making full foot contact with that wall. We have the heel, we have the big toe, we have the little toe. We can feel the arch of the bottom of the foot being pushed into the wall. This is on both feet. We never lose the heel. We never lose the forefoot, the midfoot. Throughout any of this movement here in this drill, we always make sure we can feel both feet firmly into that wall. Now, what we do here is we are going to push. You can see he's already done it. Push this left thigh forward without arching our low back, without getting any sort of crazy, don't let the whole thorax come along for the ride. We're just pushing, and even if it's just a little bit, an inch or two does a pretty good job here. We just push that thigh a little bit forward. And here, we're going to work on that breathing again, exhaling through the mouth, feeling the side obliques turn on, tucking those ribs down to make sure that we are staying in a nice, perfect straight line. And then we are going to inhale through the nose as we maintain some of that oblique tension to help keep those ribs down and tucked, right? Keep that stacked position. Even when we're side lying, we got a nice pelvic tilt. So we are dragging our heels into the wall, getting a posterior tilt. We can feel that pelvis kind of tuck underneath them. We're breathing to get our rib cage to stack over that pelvis. And then we are pushing this hip down towards the wall just to get some length through there. Those three things, we push that thigh forward. And then from here, this is key, is we start to raise that knee towards the ceiling. So you'll see here as he starts to raise that knee up towards that kind of up top corner of the ceiling. And that is turning on and getting that glute max isolated to work for external rotation. It's going to bring some hip external rotation to that hip. It's also going to teach the glute max to start doing external rotation again. It gets a lot of love for its role in extension of the hip, but it's really a primary mover as external rotator of the hip, and we have to use it to push ourselves into the opposite side. So a really important drill that's really fires up that glute. Now from here, same thing, same foot contacts, same hip being pushed down towards the ceiling, same posterior tilt, right? So we're pulling those heels down the wall, getting that pelvis to tuck underneath us. Same exhale, breathing cues to get those ribs stacked over the pelvis. Now from here, we're laying on our left side and we're going to do something different. We're going to pull or push this knee down towards the ground. And then, sorry if you missed that there. What he's doing here is pushing. He's already done it. He started from kind of a pushed out position. He's going to pull that knee down into this little roll here, and then he rolls that hip back in towards the hip socket. So again, it's hard to see, but without using that low back or arching or extending the low back or bringing the whole thorax back or anything like that, he has pushed this knee down towards the ground and then pulled it in towards his hip. And what he does there is he does both of those things at the same time, while maintaining a kind of push of this hip towards the wall, dragging these heels, maintaining that pelvic positioning, is he's getting that right groin to fire hard. And it's isolating that right groin and adductor muscles that are doing that action of pushing that knee down towards the ground. Now again, when we're standing up and we're in a closed chain and we have a weight bearing on that foot, if we do that same thing, this hip or this foot can't move or anything like that. What it does is it actually pulls our weight into that side. So that's what we're training here. We just did the left glute to push us into the right side. Now we're training the right side to pull and accept that weight into the right side. What these drills did is they cleaned up that last 5 or 10 degrees of internal rotation we needed to get to that full 30, like we had talked about. So really hammering that asymmetry, because we only do this drill on this for this right groin. We only do the other glute max drill for that left groin at this stage to address those remaining asymmetries. And then the last thing we do is we put them both together, because again, we have an overall goal here, which is we need to be able to do this in a weight bearing snatch position under kind of violent action and load. So we need to teach these things to work together. What we're doing here is something similar with the breathing, stacked position. We are pushing this leg out away from us as far as we can. We are pushing this foot into the wall just slightly, just to maintain that contact. And then from there, he's going to roll his hips forward. And then he's trying to raise this knee towards the ceiling. Now he's already doing it, so it's hard to see the actions taking place. But again, what he's done is he's pushed this leg long as he can, and then rolled forward, which has turned that left glute max on. We're getting some internal rotation actually just by default on this bottom side, but we're also using our groin to raise this knee towards the ceiling without ever losing a full foot contact. Again, it's really important to make sure that we're getting that relative motion through there. So it's limited. It's not much. This might even move just a half an inch. It might not even move off the ground. So long as we're activating that groin and feeling it, and we're feeling that left glute max, and we have a towel under the ribs here to feel that side ab crunch towards this side as he exhales, and we have everything moving together. We have these obliques contracting on the exhale to pull us to that down towards that side. We have this groin working to pull us towards that side, and we have this left glute max working to push us to that right side. And this is how we start to get all these things working together at the same time. It's called the abduction shift drill, to pull us towards a certain side, pull and push us at the same time, to really start owning that right hip again. Okay, and then phase 3, which is where we're kind of putting it all together. We're doing dynamic work here, really integrating what we've done in the rehab floor, the hands-on floor and table, and putting it in the gym space or whatever the patient might be. You can think about putting it onto the golf course, putting it onto the range, putting it into the weight room in some regard, right? So putting it all together, I'll give you an example of some drills. Some things we wanted to work on specifically in this case is being able to keep that foot flat when we are, and keeping the weight evenly distributed in both feet, and without having to shift to one side or the other, that we can accept load equally into both hips as we squat down, even in the overhead position. And to do this, we need, hip range of motion, knee range of motion, tibial internal external rotation of motion, knee flexion range of motion, foot and ankle dorsiflexion, pronation, and supination motions, but not just range of motion. We need stability, control, understanding which muscles to use and when, how to integrate these muscles so that they know how to work together. Again, stuff we did in phase 2. Phase 1, we were opening up the mobility and all these. And so phase 3 is really just about putting it all together and then cleaning up the very last bits of the patterning, the control, and any little bits of mobility that are still there to clean up. That's what phase 3 is all about. And let's just look at a few exercises of many, many, many drills and exercises that we do that we started peppering in towards mid-stage 2 and late stage 2, and then full stage 3 stuff that we were doing here with this client. Okay, and here is an example of a kind of phase 3 drill to, again, start really weight bearing, start using the mobility and all the asymmetries that we addressed earlier in a more, you could say, dynamic way, right? So this is a lateral kickstand hinge where we are pushing our weight towards that right side and then hinging back. So what we're doing here, again, keeping full foot contact, is we are asking this hip to do so much internal rotation. All that space that we just cleared up, we're asking it to do it under a weighted position, really challenging it. And then from there, we even have this foot, these toes elevated, which again puts us in another position to really bias internal rotation up and down this whole chain here. So we are asking this hip, we are shifting into it again. We are learning what that feels like. We're pushing out of this left leg, just like we did on the ground. And we are feeling that shift, that weight shift into that side as we hinge and squat down through it. And so shifting weight into that hip as we also hinge backwards. And again, all these movements are biasing internal rotation at that hip, really forcing us to use all of that mobility and integration that we did in phase 2. Another example of how we used more dynamic exercise to bias our ability to shift into and use that hip for internal rotation and force production. We have a staggered stance where this right foot is just slightly behind the left foot, about a half a foot back, and then we are doing a swing out of that hip. So again, sorry for the lagging there, but what's happening here is he's swinging into that right hip and then using that stretch, that right hip, and that shift to then shift out of it, right, and being strong into that right hip. So he's accepting so much force and load and weight into that right hip as he comes back into that right hip. So a great drill for building more rotation and then owning that rotation, being able to use that rotation, being comfortable using that rotation. And an example of a phase 2/phase 3 type thing where we're addressing actually supination of this foot. He had kind of classically wanted to evert the whole foot, so we were working on his ability to supinate, which is create this arch position here. So you see here the arch is coming back a little bit, it's existing again, and then for him to close that arch down. So he had kind of existed in a what you might think was a flat foot position, but it really was an oriented, everted foot, where the whole inside edge of the foot was just in contact with the ground. So we're teaching him in this drill to pull that arch back up, and then from there we were able to retrain him how to actually push and pronate through that foot at the right times, using the right things, rebuilding that tibial or that lower leg internal rotation as well as that upper leg internal rotation so that he can actually do these things and these mechanisms. Really important. And so we can see in this drill here, as we come down, pronation, and then being able to supinate back up. So really biasing supination at that end position there. Really important to open up that range of motion back into the foot so that we can do the exact opposite, but only at the right times and with the right motor control and patterning. And again, I said I'd keep it pretty brief. We did a lot of different work in this phase 3 to get things moving again. Here we are really testing it with a snatch balance, right? So we have velocity, we have heavier load, in this drill where we are really trying to get that full connection there, right? So compared to what we were seeing with him previously, this is fantastic. Again, with this exercise and drill, we're asking a lot from that hip so he can comfortably sit equally into both hips. And what we see here is that he does just that. He's able to sit relatively equally in both sides, and we can continue to work. So you can see how he's a little bit shifted towards the right in the trunk here, and this is actually allowing him to just slightly shift more into that left hip. So we just have a little bit more work to do to give him the confidence and the control to understand what it feels like to actually keep neutral, because again, we have that space for it, but otherwise it is much better. You can see how he's able to keep that full foot contact even in this overhead position here, and then push and pronate and create force out of that foot on the way back down. So again, some fantastic work. He jumps up to catch it, and then again, able to maintain that full contact there through the heel and outside edge and inside edge of the foot as he steps it back up. So a great example of a phase 3 progression where we're actually doing true snatch balances with the patient and client. Okay, so thank you for listening. This was Integrating Rehab and Performance Part 2, the treatment. In this case, is performance, patient, and client, where we were working on that snatch, catch, positioning, and things like that. These are just some examples of the thought processes that we went through the exam and the treatment to get this patient back to 100%. Again, we used in-session treatments such as chiropractic adjustments, soft tissue work, and then very specific correctives and exercises for this patient based off his goals, what brought him in, whether he had pain, we would address pain, things like that. We also had programming that I had set up for him as we progressed along, that were addressing our goals after we had mastered some movements and found the winners, right? The movements that were doing the things we needed him to do, that were programmed for him to do in his off days that he wasn't in clinic, so that we, again, we're just taking a full steam ahead approach with all my patients and clients, where we use things like that online programming for them to look at, has video demonstrations of the exercises and movements so they can remember how to do them properly. And again, especially phase 1 and 2 stuff, where the cueing is so important to do it specifically, exactly correctly when you're working on certain things like this. And and then beyond that, after seeing them a couple days a week for 6 weeks, and then the online programming is where we start to see results like this, and then phase 3 stuff where we get into all the fun stuff to make sure that everything is kind of working towards his actual specific goals, not just getting hip internal rotation back or tibial internal rotation, not just learning how to push through the left glute max or pull through the right adductor, but to make sure all that's translating to the actual goals, and then working and learning how to use those new ranges of motion and muscle connections to do that, the specific movements. Again, some of that was seen in the snatch balance, and then we've done some actual snatch work as well that we'll be doing to fully integrate this back in, and it just needs a couple bits here and there to put it all together after all that is done. So I think you have a decent idea of what treatment looks like at Integrated Rehab and Performance Center, whether you're a rehab or a performance client or patient. And thanks for listening. Check out the companion article to get a little bit more details on some things, and then be able just to, again, see the progressions written down in words with some other clarifications or examples of how we went through and did things like this. So thanks again for listening. We will see you next week.